Hello, my name is Soraima. I will be your nurse practitioner today. Nice to meet you.
Nice to meet you too.
I will you assess your head, mouth, eyes, neck, ears. Are you agree?
Yes, I agree.
Okay.
We have to inspect the head, neck and face, looking for symmetry, facial expression, any abnormality like edema, tics, change in skin colors, tremor. We have to inspect the skull and scalp and facial structure for size, shape, lesions, trauma, pallor or pigmentation variation. Palpate the head and scalp, looking for tenderness, any abnormal movement, hair texture, color, and distribution. We have to palpate the temporal arteries, looking for thickening, hardness, tenderness. Palpate the salivary glands. We have to palpate the sinuses.
Do you have any pain?
No.
Looking for pain or pressure.
I will put the pain over your face.
Transilluminate the side. We have to assess the neck. Start by inspection in the usual anatomic position, in a slight hyperextension. Look for bilateral symmetry, sternocleidomastoideo and trapezius muscles, alignment of the trachea. We can look for mass, palpate the neck for tracheal position, lymph nodes, looking for size, shape, configuration, consistency, tenderness. We can palpate preauricular, posterior auricular, occipital, submental, tonsillar, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Also, we have to evaluate the range of motion of the neck, asking the patient to flex and extend.
Flex, please, the neck. Extend. Thank you.
Turn the head and neck to the left and to the right. The movement should be smooth.
Okay, thank you.
If we find nuchal rigidity resistant to flexion of the neck, may be associated with meningeal irritation. Also, we have to assess in the neck the thyroid gland. Involve inspection, palpation, occasionally auscultation. We ask the patient to take a sip of water.
Yes.
and observe
Okay. Thank
and
you.
palpate the thyroid gland. We can find tenderness, nodules, enlarged gland. Pulse in the neck, we can auscultate the carotid pulse.
Yeah, in previous assessment, I auscultate the carotid.
The eye exam start with inspection. Inspect the ocular structure, eyebrow, looking for hair texture, size, orbital area, looking for edema, lesions, the eye light, ability to open wide and close completely.
Close your eyes, please. Open.
We can find ptosis, redness, swelling. Palpate the eye light for nodules. Looking for color, any discharge.
Do you have any pain on your eyes? Any discharge on your eyes? Any history of any disease? No. Okay.
Lacrimal glands, pterygium. We can assess the cornea, the pupillar size,
You cover the eye.
the visual acuity testing is to measure the discrimination of small visual details.
Okay. Cover your left eye, please. Let me see when you see my finger.
Yes, I see.
Cover your. Let me see when you see my finger.
I see it.
Okay. Focus on my nose. Follow my finger, please.
We are assessing near, distant, and peripheral vision.
Could you stand up to see this eye chart? 14 feet. Okay. Let me see what is the smaller letter that you can see.
The smaller letter that I can see is the P that is in
The first
the
letter of
first. Okay.
P. Okay, thank you very much.
In the eyes, we can to assess the pupil equal reaction to light and accommodation. We can also examine the patient with the ophthalmoscopic. Examine the patient's right eyes with your right eyes
Could you see a real nerve?
and the patient's left eyes with your left, looking for lens clarity, red reflex, retinal color and lesions, the blood vessels characteristics, macula characteristic, and depth of anterior chamber.
Okay.
The examination of ears, nose, and throat provide information about the ear integrity and function, as well as the associated respiratory and digestive tract. Inspect the auricles and surrounding area for the following: size, shape, and symmetry, color, position, deformity or lesions. Palpate the auricles and mastoid area for tenderness, swelling, and nodules. Inspect the auditory canal with an otoscope.
Do you have any pain?
In the auditory canal, we can assess for cerumen, color,
Please.
lesions, discharge, foreign bodies. And we have to inspect the tympanic membrane for color, landmarks, perforations, and mobility. Also, we have to assess the hearing
Could you cover
through the following.
let me see if you're here. 21.
Yes.
What I say?
21.
Cover your dry eye. 25.
25.
Okay.
The Weber test, base of the fork in the midline of the head, and
Let
ask
me
the
see.
patient.
You're feeling the sound equal for your eyes.
Yes.
Okay, thank you.
And the renal test,
Let me
set
know
the
when
turning
you
form vibration
cannot hear the sound.
and place the base against mastoid bone.
Mm-hmm.
Are you longer here?
Then place turning form in
Yes.
front of the patient ear.
Cannot hear
I cannot hear.
Thank you.
I didn't hear.
Inspect the external nose, noting the shape, size, color, and nails.
Could you cover the right nostril?
Palpate the bridge and soft tissues. Assess for
Cover the left
patency.
nostril. Inhale. Thank you.
Notate any tenderness,
Do you have
displacement.
any pain, any discharge from your nostril?
No.
Inspect the nasal mucus and nasal septum with the nasal speculum. Assess for color, discharge, perforation. We can find polyps. Inspect and palpate the lips for symmetry,
Open your
color,
mouth.
edema. Inspect the teeth for occlusion. Loose or missing teeth. Surface abnormalities. Palpate the gingiva and buccal mucus for colors, lesions, and tenderness. Inspect the tongue for color, swelling, ulceration. Inspect the palate and uvula.
Open your mouth. Thank you.
Use a tongue blade. Assess for gas reflex. And inspect the oropharyngeal characteristic of the tonsils and posterior wall of pharynx using a tongue blade to depress the tongue.